Merry Christmas to all our Christian brothers and sisters from the entire Health Affair crew. A prosperous new year in advance to everyone. It is another exciting edition of your favorite program, Health Affair on AIT. It is a program where we beam our searchlight on health challenges with a view to finding lasting solutions. I am your host, Oshuomowa Daniels. To minimize the effect of the second wave of the COVID-19 pandemic on Nigerians, some health experts are calling on the federal government to pay more attention on non-communicable diseases, as they constitute the underlying factors that makes COVID-19 more deadly. These and many other interesting issues we have for you today on the program. Please stay tuned as we begin with our news segment.
The Lagos State Governor, Babajide Sanwo-Olu, has expressed appreciation to Lagos State residents for their prayers of quick recovery for him. In a press release on the resurgence of the COVID-19 pandemic, the governor said the public perception that COVID-19 has ended in Nigeria was unfortunate and absolutely wrong. Governor Sanwo-Olu warned against large gatherings in concerts and street parties, usually associated with the Yuletide celebration. He said the second wave calls for a full reawakening of caution and strict adherence to the preventive guidelines to avert the disastrous consequences of the second wave of the pandemic. The second wave of COVID-19 pandemic is spreading very fast, with a daily record of confirmed cases that has surpassed 1,000 as at the time of this report. It is to check this spread through increased media advocacy and community engagement that this media training on COVID-19 response by the Lagos State Government and LAFIA, a UK government-funded program, became necessary. For most participants, an update on the governor's health and the idea of people falsifying COVID-19 test results were of utmost importance.
The governor is doing very well. His health is improving. I mean, there were never any serious issues to start with, but he's even feeling better every day. Everybody's at risk. We're finding that people are dying, people of different ages are dying. Now, it's not just death. We're also finding that people are having long-term disability from COVID. They survive it, but then they are left with other things, other effects on them that continues to affect them going forward.
We're having reports that some people are getting their results without being tested. So this is an issue that the federal government especially has to look into. We have to really firm up from the airports, especially before the airports, make sure that everybody coming in is actually screened.
Implication of the second wave and the correct use of the nose mask were also brought to the fore.
Government is considering and we're looking at it on how to regulate. We have to go back to the restrictions that we give in terms of gathering, the number of people that gathers, in any, whether in party, big parties are going on and people are negligent. They are not using the face mask, they are not using, no social distancing, they're not using hand sanitizers again.
It's not just about wearing the mask. They must be worn consistently, they must be worn properly, and they must be removed properly. And that's the only way that it works to protect us. The lighter colored part, which is usually white, should be inside, and the colored part, which can be blue or green, must be outside. The way it works is that lighter part, the white part, is the one that absorbs your own secretions as it's coming out, and while the colored part prevents the secretions from outside from coming in.
Everyone deserves the love and merrymaking associated with the Christmas and New Year season. Despite the challenges brought about by the COVID-19 pandemic, many residents in Lagos State are in celebration mood. The physically challenged children are not left out of this. We visited Magnificent Therapy, a home where children with cerebral palsy are taken care of, to be part of their celebration.
As a parent, we feel there's need for us to be part of this, whether they are they have special challenge or they don't.
I give glory to God that I'm alive today to witness my son's school party. May the name of God be glorified.
According to the Center for Disease Control and Prevention, CDC, cerebral palsy is a group of disorders that affects a person's ability to move, maintain balance, and posture.
It happened during before birth, during or after birth. For instance, it may be due to medications, it may be to infection, it may even be to domestic accidents. For instance, maybe couples are fighting and the man accidentally, out of anger, kick the woman, and it may affect the brain of the child, especially of birth. That is lack of oxygen during the course of birth. That's the last push. So that's how also affect the child. So at the end of the day, it will make the brain to paralyze. Run medications during the course of pregnancy can also cause cerebral palsy because whatever the mother takes is what the child takes in the womb. So if there's a wrong medication, it will affect the brain of the child. So this can lead to preterm. Even if it's not preterm, even after 9 months, it can lead to collapse of the brain. That is collapse of the nervous system or the brain itself. So anything that is collapse or damage to the brain is cerebral palsy.
My son is a child living with cerebral palsy, a case where he cannot talk, where he cannot walk, where he has difficulty in coordinating his arms and some other areas. So, but it is very, very challenging and financial demanding, taking care of this kid.
The most thing that they need is fund, that's money to assist them because we need physiotherapy, occupational therapies, speech therapy that will help these children to move in a society. So with the finance and support of the government and individual, it will help this school to move forward, to help the future of these children.
Welcome back. Non-communicable diseases, NCDs, such as diabetes, hypertension, cancer, stroke, heart disease, chronic lung disease, and others, according to the World Health Organization, WHO, are collectively responsible for almost 70% of all deaths worldwide. The rise of NCDs has been attributed primarily to 4 major risk factors, such as tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity. More worrisome is the fact that these diseases are expensive to manage, a situation that has deteriorated with the COVID-19 pandemic. I spoke with an experienced physician, a global health leader who was recently honored by the President of Finland with the Lion of Finland Knight Award, Dr. Kingsley Akinroye, for the contributions he made in the Finnish health and education sectors. Dr. Akinroye will be telling us about the challenges of non-communicable diseases in Nigeria and the plight of patients under the COVID-19 pandemic.
Well, we are aware now that non-communicable diseases are diseases that are not spread from one to the other. That means they are non-infectious disease. They are not like malaria, they are not like typhoid, they are not like tuberculosis, but they are diseases. Number one of them is heart disease. 2 is diabetes, cancer, sickle cell disease, and close to that are also lung disease. And we also know that we are extending. Road traffic accident is also a non-communicable disease. So these classes of diseases are the ones that are really premium. But when we discuss globally and also in Nigeria, we focus mainly on the first 5 that I mentioned. In Nigeria, we do know that non-communicable diseases are rising sporadically in the last, say, 20 years. And especially above the age of 30. Hypertension is one of them. It's a heart disease. The number of people with hypertension is rising in this country. and it has risen up to the level of about the age of 18. We have almost 30% of the population of Nigerians are living with hypertension in the adult population. When you talk of diabetes, it's almost scaling also 10%. About around 12% of the population are also living with diabetes. Of course, sickle cell disease is also relatively very high, and of course, cancer is next to, in terms of the number of people living with cancer, is also rising in this country. The most commonest one is hypertension. In any family you go in Nigeria today, there's hardly any family, when you get 4 people together, the chances are 3 out of 4 people you collect together, they have high blood pressure. And the treatment for high blood pressure, by the time you get it, in a month, ideally, it is not likely that you spend nothing less than almost 20,000 naira if you want to take the treatment, because most patients with hypertension, they don't take on drugs. More often than not, they take the drugs. And if you want to pay the doctors, you want to pay the cost for your tablets, which you take, it can't be less than between 50,000 and 20,000. How many people can afford that in the country? There should be provision made for people that are living with non-communicable disease to have special attention. Somebody who has stroke in Nigeria today, when there's somebody with a stroke, that family is most of the treatment is going out of their pocket. The money they're supposed to use for their daily living is what they will be using for the stroke. We don't have stroke centers in this country. How many stroke centers do we have? Then we are not talking about go back to also the consequences of hypertension is kidney damage, which you will need dialysis, exactly what you've mentioned. How much is the dialysis, which most of them, they will either do dialysis once or twice or 4 times in a month. And how much does that come to? Each dialysis maybe cost about between 25,000 to 40,000 naira. So how do they live? It is then synonymous with death. Once you get to that level, or you have cancer, you are going to die. How do you care for people who are going to have consequences of diabetes, people who are going to have consequences of cancer? Of course, you also know the commonest cancer we have in the female population is breast cancer. And how much, if a female patient develops cancer of the breast, how much is just going to be? So it's very, very expensive to take care. The same thing with men, when they have their prostate cancer, it's also very, very expensive. So these are the things we live by every day in this country. And we put it aside and look at it. And of course, when challenges like COVID comes, they succumb to it, because already their body defense mechanism, which you call their body protection, their body immunity is very, very low. So all this long-term disease affects their body defense mechanism, and that is why they die.
A lot of people have kidney issues, they have heart diseases, nobody's helping them. COVID is not killing people directly. People who have underlying factors are dying. Then what can government do to make sure that those who have underlying factors are taken care of, so that the effect of COVID will not be much on them?
Thank you. Well, one of the things other countries do is to have them give special attention to them. What can the government do? I think we still have to look into the area of policy to be able to do that. But in the interim, we are not going to say we should wait until when we are able to get a policy approved, drafted, and implemented before we will do that. During the COVID era, when we had lockdown, most of the drug shops, they were shut. Most of the pharmacies were shut. People cannot even go and buy their drugs. People who needed tablets, for like injections like insulin, they cannot get it because they have to be imported to the country. You have to go to special centers. So people who are on cancer, they cannot get their tablets available for them. So these are the challenges which we need a good health system to be able to look ahead. Recently, we have what they call the Basic Healthcare Provision Fund. The Basic Healthcare Provision Fund has been introduced to this country just in the last 4 years. And we have only about 2 or 3 states that it's supposed to be it's a federal government initiative, which states are supposed to take part in it. And states have set up their own health insurance system. And each state is supposed also to be able to make some contribution and also with the federal government. But it is dragging its feet. So if this basic healthcare provision fund is available, then everybody will benefit from it. So that will answer your question, because if you look at even the budget we have for health in this country, I'm not sure we have scaled more than 8% of the budget. And even out of that 8% of the budget that has been paid, that is being said, how much of it really goes into really being released to finance health? So I feel like what you say, alternate funding is what we need. And the Basic Healthcare Provision Fund, I'm an advocate of that, and I believe this is what is going to help people live with NCDs, non-communicable disease. We need to strengthen our health system, and especially the primary health care. A greater percentage of the population are supposed to benefit from the primary health care. So it is not only the building that we are talking about, we are talking about functional primary health care centers. If all the primary care centers are functional in terms of availability of care for heart disease, what do we need? Basic things should be available. In terms of personnel, if you will agree with me, we have, if I'm right, we have almost about 700 health centers in the whole of local government in the country. If all the 700 local governments have at least a functional primary healthcare center, then this country will move forward. So there will be no threat to any disease that is coming, because epidemics come like every 10 years. So we are still going to have another epidemic after COVID. This is not the last epidemic that is going to happen. Another one is going to come. But the primary care system, if we are able to, one, look at our personnel, the nurses that are manning there, the young doctors that are there, and the system is there. If the primary care system is functioning very well, then there will be no threat to life. If the care is there, then we can talk of the general hospitals, we cannot talk of the tertiary centers, our universities, teaching hospitals.
So summary, I can say that for us to defeat or to minimize the effects of COVID-19, that government should pay attention to non-communicable disease.
Thank you very much. Yes. So we'll be able to, because when there's an epidemic, everybody in the population is affected. Even from the children, they are affected. But from the experience we have seen with COVID, the number of people with those type of diseases are more in the population. When you expose everybody, at the end of the day, those with non-communicable disease, they will get more ill, or the number of people that are going to be ill are going to be more. And the number of deaths are going to be more among those sort of people, especially the male population and those people that are obese, those people with weight. They are also more prone to be attacked when they have COVID. It's likely to be more devastating and may lead to more death in that population. So the government should also be able to, we should be able to make a focus, a decision to be able to let them have special form of access to treatment during epidemics like during COVID.
So it was nice having you on the show. Thank you very much. We appreciate you.
Thank you very much.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
Welcome back. Now let's take it to our nutrition segment where we'll discuss your health and your diet. Our focus today is on garlic onion. Garlic is a part of the onions family, and the bulb of this typical herb consists of 10 to 20 smaller sections called cloves. While garlic is a common ingredient in every kitchen, in ancient times it was highly valued for its numerous health benefits, which are still followed in many cultures till date. Garlic can be used as a bug repellent. It can be used against plague and for many other purposes. Due to its antibacterial and antifungal properties, some nutritional experts say garlic can also help prevent some form of cancer. Every 100 grams of garlic will serve you with about 150 calories, 33 grams of carbohydrates, 6.36 grams of protein. Garlic is also enriched with vitamins B1, B2, B3, B6, vitamin C, calcium, iron, magnesium, potassium, sodium, zinc, and phosphorus. The high sulfur content of garlic onions gives it antibacterial properties that helps to keep the digestive system clean by flushing out toxins. Garlic also builds the immunity against common cold and prevents heart ailments by clearing up blocked arteries. The health benefits of garlic could go on and on. Some people cook with garlic onions. Some chew it or blend to extract the water. Why not give it a try out today to boost your immune system? But remember to do so in moderation to avoid abuse.
My sister, I don't understand how my body dey do me. Since the past 1 week now, I get one kind catarrh and cough wey no gree go. Even now sef, I dey feel tired. I con get running stomach and headache. I dey fear because dis signs resemble COVID-19 sign o.
Go do test na.
Emi ke? You say make I go do test. You want them to quarantine me?
Okay, if na that one be the case, I go make one agbo for you. I go bring ginger, garlic, turmeric, bitter leaf, ewedu, and I go come add cow, come mix am together. But e get one thing o, the thing dey bitter well well.
That one, e be like say e go work o. Make I try am.
4 days later, Lauren's condition deteriorated and she is rushed to the hospital. But she could not make it. She died before she could get help.
Those who have eyes, let them see, and those who have ears, let them hear. Self-medication kills. It is because of self-medication that most people present late at the health facility when it is too late to get help from the doctors. If you are feeling unwell, seek medical attention in good time. Next is our clinical segment where you get vital tips from experts on how to stay healthy.
It would be irresponsible of us to drop our guard because the consequences of a second wave is again a lockdown, and we don't want a situation where it impacts our economy again. So maintain our observation of social distancing, hygiene, and just precaution.
Please be part of our perception segment and tell us the way forward for the nation's health sector by reaching across to us through our social media handle and the phone numbers showing on your screen.
There are laws governing us in this country, and this law has to come up now. People have to be sanctioned for doing wrong things, whether it is for the palliative that was not released at the right time, whatever that has gone wrong in this system, we have to learn from it, we have to correct it. And at the same time, people that have done wrong things, they have to be sanctioned. There is no reason for anyone to keep the palliative food or food items in the bags and be giving it out on his or her birthday. This is wrong. And we have evidences of that. Somebody giving out palliatives on his or her own birthday, and it is written there, Kakobe, then we have to sanction the people. Unless we begin to sanction people, then that will give the confidence. The masses will have confidence, the government.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Please join me same time next week. My name is Oshuomowa Daniels.